In the communities we serve, a lot of times without having employment, you quite frankly don't have health coverage. So there's a big correlation to being employed and getting adequate care, whether that's preemptive care, whether that's responding to some other ailments you have. But what we find is the people who are unemployed, not only are they not seeking health coverage, they're using the emergency room primarily as their primary physician. Not to mention all of this stress that comes for looking for a job or comes with being unemployed or that just comes from living in poverty every day, which my assumption, not being from the medical community, is that, if you have a lifestyle that's more stressful than others, if you don't have money to cover basic needs and so forth, and every day is this rat race, just day after day, the impact on your body and your health, my conclusion would be a lot worse than those people with adequate care or access to care. So employment is minimally a vehicle for coverage, but without it, I mean, really, we're kind of left to emergency rooms and our opinions. I guess it's more than just having a job too, because quite honestly, if you're underemployed or you have a physical job or a stress job, because let's face it, most low-paying jobs are highly stressful. You don't have a lot of control or say in your daily activity, and those leads to a lot of stresses also. So being underemployed is also probably just as problematic as it is to having a healthy lifestyle. Because at the end of the day, it's hard to have a healthy lifestyle when your basic needs aren't taken care of, such as housing, such as employment, such as living wages, and so forth. So it's really about having a quality lifestyle, which gives you the luxury to actually have a healthy lifestyle. It's really about empowerment, really, right? So, I mean, when it comes to employment, it empowers you to make better decisions. It's getting the community more involved and giving them more voice in their own lives and in policy. So the community definitely needs to be engaged as far as political advocacy around a lot of medical issues. A lot of times, the only people, quite honestly, that are at the table are people who have health coverage. So when you are marginalized, it means just that. Your voice is not represented in those conversations. And quite honestly, as long as we have a system where healthcare is tied to quality employers, and you have a situation or a people who don't have quality jobs, you're always going to have this health disparity. So it's really about empowering the community to become more of a solution to their problems by bringing them to that table of policy making and so forth. But that has limitations also. So I think our leaders, political, within the health system and so forth, also need to reach out and kind of help bring those voices to the table and bring policies around that, because healthy lifestyles and great health is just a community benefit. So we need to stop looking at it as an individual thing, of poverty or outside of poverty, this race or that race, and just look at it from a community wellness standpoint. The better we are individually, the better we are as a community. And it's similar. I mean, I think all these things are interrelated, right? So if you have poor housing, 9 times out of 10, you have a lot of ailments that come from it that a lot of people don't correlate with it. So lead-based paint leads to brain damage within youth. So you start off in poverty, you have a substandard home, your children are exposed to lead-based paint, and maybe you have other issues such as rodents and so forth, which increases the likeliness of having asthma. And then you take this perfect storm of environment which feeds into your health, and then you don't have the available resources, or maybe you just don't know how to take care of that, right? So you don't go to the doctor regularly, you're not getting checkups, you're really just taking care of it in the emergency room, and then you're returning back to that same environment. So we would argue, and I think there's even nonprofits around town, or they are, such as Healthy Homes, and the great work of Paul Hahn, that really knows that really a safe home environment is the best way to have a healthy environment, because it all starts there. Now, unfortunately, there's been some reduction in funds, and we don't do the lead abatement work, but at one time, Grand Rapids had one of the highest lead rates in all of the country. And then you correlate that to not only health, but to educational attainment and so forth. And a lot of this really starts at home. So when you see the increases in asthma, when you see the increases in autism and so forth, are we really making that correlation to the physical environment that these families are in? So we would say health and we would say housing is more important than just economic stability. It's really the beginning of a healthy lifestyle, or an important part of a healthy lifestyle, which once again is just going to have better consequences for the whole community. There's definitely a correlation between safe housing and health care. When you have adequate housing, when you have a safe environment, and you're not exposed to things that are going to increase brain damage and asthma and those other factors, you're going to just have a healthier life and a healthier family. Thus, we're going to have a healthier community, because healthy homes are really, really paramount in having a healthy environment. I think looking at how do we achieve health equity is really no difference than any other equity, right? We have to really redefine how we look at equity. And equity has to be defined as the ultimate outcome. So what are those things and what are those policies we can put in place where the Hispanic diabetes rate looks like white diabetes rate, where high blood pressure for the minorities equals the same as the high blood pressure rates for the majority. And unfortunately, right now, we have this tendency to blame individuals. We have this tendency to blame lifestyles, which are definitely an important part, and personal responsibility is a part of ultimately being healthy. But we also need to acknowledge that individuals who have everything against them can't do it on their own. So you don't have, so the argument really doesn't work, right? When I take out your ability to choose your home and it's unhealthy, your ability to choose your environment, which has and increases health care disparities, and then your inability to move out of poverty, which we know perpetuates not only a lot of social ills, but health ills. So while we definitely need to practice and communicate personal responsibility, we all as leaders and community members need to also understand the systematic issues around how we currently define equity that's perpetuating a lot of these healthcare disparities also. So it looks a little something like this in our world, right? So you have 4 populations and you have a healthcare issue. You have $100,000. Equity currently is being defined as, hey, let's give every group $25,000 to work on those disparities. It doesn't take into account where that group started off. It doesn't take into account if diabetes is higher for this community, maybe we need more input over there. It doesn't take into account if high blood pressure is higher in this community, maybe we start there. So ultimately, healthcare equity is just like community equity, racial equity, housing equity. It's really saying at the end of the day, the outcome needs to be equitable. And we need to be willing as community members and leaders and residents and really demand that we look differently on how we allocate resources and how we allocate programming to make sure it takes into account where you're starting off at and what community you're starting off at. Because unfortunately, if not, we can be great people. I guess we shouldn't really be surprised that there's healthcare disparities in some of the neighborhoods in Grand Rapids. I mean, a quick tour around Grand Rapids will show, you know, neighborhoods are drastically look different if you overlay race and income. And whenever you have concentrated poverty, regardless of what's going on, you're going to have some social ills, healthcare ills, housing ills, equity ills. So as divided as some parts of Grand Rapids are, and how we concentrate our poverty, our bad housing, and how those are really just issues of certain neighborhoods, we can't be surprised then that the health disparities in those areas are also disproportionate. I think if you're going to look at housing as it relates to healthy living, you have to not look at housing in isolation. And unfortunately, revitalization efforts, nonprofit efforts in our community work in isolation, and they don't really see the correlation between healthy outcomes and housing and so forth. So if you do housing just in isolation and you don't do economic development, you don't do community engagement, you don't do anything for the environment, you're just basically going to have this beautiful island in a sea of despair, right? But you have to really look at the community as a whole and see what kind of opportunities are you offering and what those other activities that go along with housing. Because I would offer housing alone is not going to make your neighborhood more walkable. It's not going to make you feel safe to get out in the parks and play. So revitalization has to be very holistic, and it has to understand that housing is a piece, but we can't just pat ourselves on the back because, you know, out of 20 dilapidated houses with lead paint and asthma factors in it, we have 1 new rehab. And currently, unfortunately, that's the way we do revitalization in the city of Grand Rapids, is we don't look at the big picture as much as the individual project. You do the best you can and you go to the emergency room. I mean, unfortunately, it sounds very counterintuitive, but healthy living is not the experience or the goal of a lot of the clients we serve or the residents we're in contact with. Living is the goal. It's day-to-day survival. It's living without a job. It's living without quality housing. It's surviving on limited resources to raise your child as good as he can to get out of high school and so forth. So unfortunately, a lot of us talking heads like to say, it's just about this or it's just about that. Well, that's easy when your basics are taken care of. But I would say the lived experience of the communities we serve is, unfortunately, healthcare is like a lot of other things, and it's a luxury because that bottom, the necessaries aren't there to begin with. And you can only think about better life if your food is taken care of, your housing is taken care of, you have a job. But if you don't have those things, that becomes your priority, not your health. I think that community would offer opportunity, right? I mean, it's where one zip code doesn't dictate your ultimate health or your ultimate success. So it'll look a lot like communities that are around West Michigan. Unfortunately, it would look like a lot of communities that are within 5 miles of the communities that are suffering. So it's not like we don't know how to do it. It's just more intentionality from leadership and policy to provide true opportunities that lead to healthy lifestyles. We have to get up and do something and make change. Change is that, it's changing. We cannot feel good that we have good intentions. We cannot feel good that we individually are great people. We must measure our success by impact. What impact are we having in a community? How are these health disparities declining? How is the high blood pressure rate in Black community going down? How is the diabetes rate in our Latino children going down? Our community is too bad off to just sit back and be good because we're trying or we're doing, we know we're individually good people. And I think it's redefining equity. I think it's redefining impact, and it's being willing to hold our feet to the fire. And we have a saying, data is friendly. We have the data. We know how to take care of some of these disparities. Shame on us if we're having this conversation a year from now.